KEYNOTE-061 was a global phase 3 study that compared Pembrolizumab and Paclitaxel as a second-line treatment for patients with advanced gastric or GJ adenocarcinoma. Unfortunately, Pembrolizumab did not show significant improvement of overall survival versus Paclitaxel, but it showed a longer duration of response in some patients. So here we evaluated the association between tumor gene expression signature and the clinical outcome. As a result, in total, 274 patients had RNA sequence data, and we analyzed 18 gene T-cell inflamed gene expression profile and 10 non-T-cell inflamed gene signature, such as angiogenesis, glycolysis, and mMDSC related markers. As a result, tumor T-cell inflamed GP showed a positive association with response rate and the PFS for Pembrolizumab, but not for Paclitaxel. For Pembrolizumab, T-cell inflamed GP-adjusted mMDSC signature was negatively associated with the response rate, PFS, and overall survival. And also, angiogenesis-related signature was negatively associated with the response rate for Pembrolizumab. So for patients with T-cell inflamed GP high or non-low subgroup, response rate was similar for Pembrolizumab versus Paclitaxel at around 16%. But for patients in the T-cell inflamed GP low population, the response rate was lower with Pembrolizumab than Paclitaxel, 4% with Pembrolizumab. In contrast, for PFS and OS, magnitude of benefit with Pembrolizumab was not so largely different in patients with T-cell inflamed GP high or low subgroup. So honestly, this predictive value of this T-cell GP is not clear from this trial alone. Then we also assessed the T-cell inflamed GP-adjusted mMDSC signature using pre-specified cutoff as a median. And for patients with mMDSC higher than median, response rate was only 7% with Pembrolizumab. But for patients in mMDSC lower than median, the response rate was 16% with Pembrolizumab. And interestingly, median overall survival was shorter for Pembrolizumab versus Paclitaxel in mMDSC higher than median. But median overall survival was longer for Pembrolizumab in mMDSC lower than median subgroup. So in summary, T-cell inflamed GP showed some association with the response rate for Pembrolizumab, but not for Paclitaxel. And importantly, T-cell inflamed GP-adjusted mMDSC signature was associated with a lower response rate and a shorter overall survival with Pembrolizumab than Paclitaxel. So it may be one of the potential resistant marker for Pembrolizumab, but still need to further confirmation in additional cohort.